suspense is killing me.
Oh, okay. Okay.
Holding our breath.
I would like to. I would like to see. You know that.
Oh, we're here. Hi.
People, yeah. Hello, everybody. Hello. We are going to start in a few seconds. I think we are getting our participants into the room.
I think I could just greet immediately Vitinis. Vitinis, if you want to put the camera on, would be great. Just that we see you and say hello to you. It's great to have you with us. I see he checked in. But...
Okay. So, ladies and gentlemen, dear participants, good afternoon. It's a pleasure welcoming you back at our civilization talks. This is the second session on dedicated to the topic of health in the eco-civilization, a series of events that we initiated this spring in very particular times when we were all challenged by the pandemic that overwhelmed our planet. We continue to explore our desired destination, the eco-civilization, from various standpoints, and I believe that the topic of health is perhaps at this moment the most striking one for all of us. I'm glad to see that so many of you are with us this afternoon again. I would like to briefly present once more our speakers of today, and I will use a slide for that so that you can remember their names and yeah. We are going to explore eco-civilization, health in the eco-civilization with Margaret Hanna, Brad Hart, and Barbara Hrovatin, and of course with Violeta Bulc, former EU Commissioner for Transport and curator of the eco-civilization. I would also like to welcome our guest of honor at this debate, Mr. Vytenis Andriukaitis, who is Violeta's former colleague commissioner, a member of the European Commission responsible for health and food safety, who is also a heart surgeon. And today a special envoy for the European region of the World Health Association, World Health Organization. I apologize. Welcome, Mr. Andriukaitis, among us. We are very flattered, actually, to having you at this debate. We have. So the house rules are very simple. Everybody is online. Everybody can join in. This is the second session that really aims at synthesizing the topics that we opened and presented last time, thanks to our speakers. We collected the questions that we would like to address through this hour and a half that we have on our disposal to get hopefully to some conclusions, and I would like to thank you to those who have contributed to them, and simply get into the first question. Let me start, Violeta, with you, and with some help of Barbara, perhaps. Can we imagine a different type of a health system, actually? A system of care, healing, preventive medicine, a more holistic, a more integrated, more horizontally integrated? And how can we imagine building it from bottom up? What is your response to that, Barbara? or Violeta. Please choose who.
Yuri, if you don't mind, let's ask Vytenis to say a few words and tell us what motivated him to join us today, because he really was incredibly responsive. I'm not going to tell how many hours ago we shared the invitation with him. So Vytenis, what do you think?
Thank you. Thank you, Violeta. I am congratulating you with very excellent, timely initiative to present such holistic approach, speaking of eco-civilization. Of course, we know very well that now we all are united in one big, big chain. Let me remind you that 50% of our health belongs to our behavioral issues. 20% belongs to our environmental issues. 20% belongs to our genetic issues, and only 10% belongs to issues related to healthcare and cure. It means that when we are speaking about eco-civilization, we are speaking about civilization which should be, focused on health and well-being as social, mental, and physical denominator of people. It means that we need to have a lot of holistic actions to be now leaders in our societies, to show multidimensional and multi-sectorial but holistic approach, keeping in mind health in all political sectors. And now is eco-civilization, because now we are facing big challenges with global eco-crisis. We know very well climate change, not only a simple word. It can affect all of us, starting with issues when you see disappearing of some species around the globe, or finishing with disasters related to desertification, deforestation, and heat waves, and so on, so on. And all those issues can affect our health. Doesn't matter, are we in Slovenia, or in Ireland, or in Lithuania. It means that now is time to really show how we all are united. Sustainable Development Goals, 17 goals, but 14 of them are related to health issues directly, not only SDG 3, but all 14 of them are there. It means that when we are speaking about eco-civilization, we are speaking about a situation to be, as you just timely raised here, from ego to eco, from individualism to cooperation, and so on and so on. I am very happy to quote you, because it's very timely, and that I congratulate you once again. I am a big supporter of your ideas as a reporter today to have European Health Union. We need to go forward, strengthening our instruments at EU level, knowing that now it is a political choice, health and ecology, now to be seen as one continuum. And now it's political choice to do it at EU level also.
Thank you.
Great, thank you very much, Vytenis. I mean, you are still full of energy and power and strength as always. And I'm glad that the timing is so well kind of covered, because while you and I had the privilege to contribute a little bit to your efforts, you're pushing for this health union and declaration. At the same time, we're trying to get a professional knowledge and bottom-up approach that actually shows possible ways forward. And hopefully we can bring few of our ideas also forward on the EU level in order, of course, to the benefit of all. So let's continue this talk, and I hope at the end we will get some good ideas what we can share tomorrow when there is an EU discussion on health, and hopefully we'll be able to connect these two communities. I will give now a way to Barbara to reflect a little bit and then share my time with maybe Jana, Daria, Elke, Uroš, and all others, Andrew, who are in the audience, because I'd like to hear what their reflections were as well. Can you guys imagine the new health system and how it should be? But Barbara, go ahead.
Thank you for this big question and this beautiful company, invigorating. I would like to point out that the bulk of the challenge we are facing, creating health, is relational. So when we are speaking about holistic, integrated systems and healing and caring, it is a relational concept. So we can, even from this regard, we can leave behind the solely focusing on it, on something particular specific, but it always has to be integrated in complex systems. As I showed in our previous meeting, even in biomedical terms, we cannot afford anymore to divide mind, body, and human environment. We have physical data that this is now untenable scientifically. So I would like to see the whole system, the whole societal systems and structures be stirred toward what is creating health. So we can, the pathogenesis and the management of diseases, of particulars, will stay with us. It has been immensely powerful, but it must become a less unique focus of our attention. We have to go bigger with health creative efforts. So I would salute any kind of intersectorial, beyond silos disciplines approach of governments that could make this open space where research, different thinking, different educating, different doing can actually happen. Just for the starters. Yeah.
Thank you, Barbara. Mr. Andriukaitis said that only 10% of factors leading to our health status actually correspond with what we know as healthcare. How can we actually unleash and emphasize the others more? How can we build it from bottom up? What can we say? How should we tackle this big idea of the health union? And who are the participants?
Margaret?
Well, I wonder whether Brett might want to come in here, because you've had a slide on your in your presentation about the contribution of the different elements to health, and I'm sure you'll have a response to make here.
Oh, thank you for that. I just might start by pointing out in the background is we're very proud of our new clinic up in Newman, which is about the same distance from here where I'm talking from in Perth to between Ljubljana and Paris. So it's quite a way, and I might just show you some slides if that's okay, which will lead to the question you've just been mentioning. So can you see that slide now?
You can see Zoom, not a PowerPoint. You just need to click on your PowerPoint.
I've got to choose it, haven't I?
We see your screen, but not the right presentation.
Where is it?
Maybe on the PowerPoint.
I've got the PowerPoint on
yeah,
my
that's
other
it. That's
screen.
it. Pop it in there. Pop it in there.
Is that it there now?
Yeah.
And you've got the presentation as opposed to the notes.
We've got the
and all
notes.
that? So if I press that, does that work? Yeah. So you got it there now?
No, we don't actually. We still have the notes, but not to worry. We can see the slides. Yeah.
Yeah. I might just reduce
That's it. That's great.
notes, and then you can. Yeah. So that's the view from the from a bird's eye view, but in fact probably a drone-eyed view of the clinic, showing solar panels on it. And I'm showing that because I'm hoping that the money we're saving from the energy bill can be actually put into health, as opposed to what our clinic really is a repair shop, which is how it's described by the guru Berwick, the health improvement guru. So that's how I tend to think of health services, is repair shops. And what we need to be doing is preventing the need for the repair shop in the first place. And we shouldn't have to resort to that to do that. And it's counter to this new healthcare 4.0, which I wasn't aware of. And I'd just like to read you an article which talks about it. And it says, do not be afraid of the revolution. Smart medicine is better. The times they are a-changing. Health 4.0 is coming. And how I interpret that is that we'll end up with smarter repair shops, which may be good, but there's an opportunity cost which is taken away from investing in health. And what we need to be doing is, rather than looking down infinitely small, we should be looking at what's been described as a macroscope. And that's defined as a symbolic instrument made of a number of methods and techniques borrowed from very different disciplines. The macroscope filters details and amplifies that which links things together. It is not used to make things larger or smaller, but to observe what is once too great, too slow, and too complex for our eyes. So if you apply the macroscope to the situation, if you look at this, the second scenario there, it's problematic, as the first scenario, which is the medical model intervention, allows for a fee-for-service funding, which is how we operate in Australia. But how do you pay for making a community diagnosis, let alone treatment? And how often do you hear people talk about the community diagnosis? So that the system needs to change. And Margaret may be familiar with this person here, because he was the CMO in 1989 in Scotland, as Chief Medical Officer. So in other words, the change needs to come from the people, and not from health service practitioners, which would have been behind that picture there. And I've superimposed on this Occupy Wall Street picture with what I'd like to see people demanding is not repair shops, but more of what makes us healthy. The question is, how do we get that information to people to say this is what they're asking for? The Occupy Wall Street, they were concerned about something, but they weren't able to fully articulate what it was. So I'm sure there's a number of people out there who would get behind whatever it is that will precipitate them to think we need to change the way things are operating. And there are some encouraging signs, with people being encouraged not to ask what's the matter with you, but what matters to you. A really different paradigm that's been encouraged with a day celebrated every year. And people are realizing the system's broken. Here this organization is coming up with what they consider to be the solution. And there's the upstream movement, upstream doctors, upstream medicine, and upstream in general for a whole range of problems, apparently in that book by Dan Heath. So I think there's some encouraging signs. So maybe talk this a bit later in terms of I know Violetta's saying there's no leadership, but it's a general feeling that everyone realizes things aren't right. But there is this concept of blended leadership, and that hence the blender up there that maybe, and I know one of the questions talks about having an avatar or a humanoid. that has the blending of lots of people's ideas coming out in a humanoid to make declarations, etc. So just some thoughts to precipitate a bit more discussion. But it's great to have this opportunity. Thank you very much.
Thank you, Brett. I believe the switch from what matters to you to what from what's the matter with you to what matters to you really resembles very well. And thank you also for this reply from whom this has to come. I have to disappoint you because I have many more difficult questions to ask, and I'll keep on begging for some clever solutions. But I would really like to know what is in the way. What are the obstacles between, or how can we remove the obstacles between people and nature, and see into the communities rather than individuals, and see into the healthy side rather than the ill side of the concept of health. Again, building in bottom up, how can we spin it, and what do we need to spin it somewhat faster? Because last time we mentioned some of the good concepts that we can follow. How can these best practices be used to build a a more holistic system at a larger scale? How can you help me out with that, please?
Mm-hmm. Well, maybe
there was this 3 horizons that I was very interested in last time. So I also have some more of that. So please, Margaret, if you can proceed, I'd be very helpful to you.
Okay, so very briefly, what I would just do is show you the slide that I had around the 3 horizons, with the first horizon being the way we do things at the moment, the pattern of the way we do things, which is becoming under increasing strain. So it's now in failure mode. We can throw more and more money at it, but it's in failure mode. It's not going to be fit for purpose in the future. And there are these new ideas that are taking off, which will be much better fit for the future. That's our 3rd horizon. And then our 2nd horizon is the innovation that we're trying to do, both to keep things going, but also potentially, if we start to let go of that way of working and that way of seeing the world, that way of thinking, we start to enable ourselves to free up the energy and the purpose behind accelerating that 3rd horizon to emerge. So that's the basic 3 horizons. But what I wanted to show you at this point was a summary slide of conversations that we've been taking place in Scotland, because, as I say, the 3 horizons starts with a conversation, and this is a compilation from over 100 different policymakers, staff across our healthcare system, summarizing concerns, their aspirations for that 3rd horizon, the encouragement that they get from what's happening already, and the innovation space. And inevitably, there are value tensions between the ways that we do things at the moment and the ways in which we want to do things in the future. And what I wanted to bring to your attention here, if I can just bring it up on the slide a little bit more clearly, is these enabling conditions on the right-hand side here. Let me just shift it over here. That in terms of answering your question, Jurij, these are the kind of things that are coming up from our conversations, that people need time to think. They need to be able to stop things that don't generate value in the system. They need that systemic collaboration, the energy to deliver, valuing and supporting staff, because people in our systems are exhausted, and that's before you got to COVID. But this wider view of health, a freedom to innovate, many different things in this sort of way in which we can nurture this transition, because we are in it. It's messy, it's difficult, but if we hold to the vision, which is what this eco-civilization conversation is all about, is a vision for our H3, and start to create these conditions for the nurturing that system, I believe that we can make the transition successfully over the next few years. So that's really what I was going to add to the piece there.
Thank you. I think it's a lot about raising consciousness, and consciousness starts with information and awareness, right? Violeta, did you want to join in?
Yeah, I'd just like to pick up at this point, but I really would like to invite everyone who has been with us and is not a speaker officially to come in as well with comments, because that's going to be very valuable. But I just like to add to what Margaret said. I think we don't have really answers, but what we need to build is confidence that if we collaborate, especially like Vitinus said, and Margaret and Bert and Barbara and Yuri as well, actually all of us are trying to bring attention to these collaborative actions where things emerge. If you hold the space with the right people, things emerge, and then you follow up. You cannot prescribe that in October 2023 we will have a solution. But what you could quite guarantee is that that we are able to organize so many collaborative sessions with this common vision of creating something that is more sustainable, that has a care element in it. It's human-centric. And I'd like to just, for the sake of an argument, bring a little bit of a broader picture than just humans, because I think that there is an incredible opportunity to realize that if we understand that we are part of nature and not human plus nature, but human as part of nature, we would be much more open for preventive actions and be able to act proactively. Yuri and I were discussing this yesterday, and about viruses and bacteria. I mean, we've been coexisting with viruses and bacteria for centuries, for millions of years, if you want. But how come that we are still so blunt and so, we know so little about them, and we're not prepared for that? Even though we're facing this every year with different flus, with different infections all over the world. So can we together, collectively, create more preventive understanding of and coexist with the nature and learn how to behave, learn how to be part instead of isolating ourselves with walls and everything else which takes a human being out of the collective natural ecosystem. So maybe we could have some responses to that. I mean, can we replace ourselves in this broader ecosystem element and believe that in collaboration, that we have trust in collaboration, that no matter what comes towards us, together we will be able to address, but at the same time, we act proactively in that direction. That would be one of my thoughts I'd like to throw.
Right, but Violeta, let me try to dig into this. I sense I think
Yuri, there's a person put her hand up here. Elke.
Oh, Elke,
is it okay
please.
To bring her in? Yes.
Elke, please.
Okay, thank you very much. Yeah, I'm fully into that. It's quite a normal thing to be surrounded, and not only surrounded, but have viruses and bacteria inside of us. If we didn't have them, I think we would drop dead immediately. So I think that I loved what Brett, you said that, and Margaret, I think you said that too, and Violeta, that we need the people and count on the people. And you showed the signposts of these people. Well, actually, we have that. I'm based in Germany, and we have every day people taking to the streets, holding up such signposts. So what we are actually lacking is the political will. And I used to be, and Violeta, you know that, passionate about the EU. I worked there for 23 years at the European Parliament myself, but I'm so disillusioned now because all the money, huge amounts of taxpayers' money, is exclusively going not only into the pharmaceutical industry, but exclusively going into vaccination, which is minute part of what health is all about. So no one of our political leaders ever mentions that we actually have an immune system. As if we didn't have any. And what I've been passionate about is, for 20 years now, is the connection between mind and body. And I'm actually working with that. I don't need any medication at all. I mean, I don't know when I took the last medication. Because I know how to work with that, and there are exercises to do that. And I actually wrote a long document about that for political leaders, where I'm suggesting, hey, combine all these areas. Why haven't you been doing this yet? Because it's not, all of it is not new. It has been around for so many years. So I actually see, I don't see any political will. And I'm even quite pessimistic about a EU health union, because that will go into one only direction, which will even carve into marble what they want. And I think it should be much more.
You mean it will carve into marble the Horizon 1? Is that?
No, I'll carve into marble this one approach towards one thing only, namely vaccinations. And once they have that, that will come up for any flu, any cold we will have in the future. So that's the fear that I have. So in order to end this with a positive note, my hope is, on the one hand, the people. They are not heard at all at the moment, even though they take to the streets every day, but they will go on, I know that, and I'm joining them occasionally. The other hope that I have is in people like you, Violetta and Vytautas, that you use your influence with the political leaders, because citizens so far don't get heard. So I'm very passionate about this, and I'm sorry for that. Thank you.
I have some feedback?
Please.
Okay. So following last week, I found it a lot of thought, but the thing that I really picked up is something that Margaret has said for a long time. It's not where we are, it's where we're going. And I've worked with people who have had very difficult childhood, and the thing I found in common is those who do well who perceive the future to be better than it is now, and will aim towards that. And I wonder if that's what we need to do. Now, one of the things that Villa said earlier is 50% of health is personal responsibility. Well, that works really well if you know how to take personal responsibility. And if you're in a community of people taking personal responsibility, that's really useful because it's modelled. So we know of Kolb's model of change, but you can only do that within your own knowledge. So Margaret last week showed a community of people, of professional people and non-professionals working to improve each other's lives. And I think we need to move to a model away from I'm going to my doctor to get well, to actually I'm going down to the coffee shop to have a coffee with somebody because I'm not feeling that great this week, or actually I can take something to community that will improve life for somebody else. And then at that point going, actually I've got a cough, I've got something that needs medical intervention. But not the first sign of sadness or disability, run to the doctor to get repaired. But a real sense of self in relation with yourself in society, but with community. One of the things of individualism, we were taught not to do community. We were taught to take care of ourselves first. And once we're okay, whatever exit we can give somebody else that will benefit us, we do it. So the idea of doing community is hard. Now, one of the things when I'd done my degree in psychology, I'd done health psychology, and one of the things that came clear was how much knowledge I got that I missed myself in life from being taught. And one of the things that I sit across party group in the Scottish Parliament, and one of the things I've called for is modules or training courses online that anybody can look at how to improve the quality of life. And I think we need to do that, is give back society responsibility for health, but give them the tools. It doesn't mean going to a doctor. So I know they use chickens for people with dementia, taking care of chickens in groups, or engine sheds for men. But I think we need to take one step beyond that and just a coffee shop for people. So you can go have coffee, and it's not because you've got dementia or you're ill, it's just a place where you can go and talk about where you really are. And that means changing society from being very much a society where we learn privacy first to a society we don't overshare, but we don't undershare either. That we find that balance. So I just think we need, it's that goal to aim to actually choose to be healthy and respect health, not choose that you may become unwell and that's okay, because that's just part of life. Instead of actually health is important and you have a right. So one of the things I find interesting in human rights is we don't have a right to health, but we have a right to life. What quality of life do we be giving people as a society? So that's my question for yourself. So thanks for letting me be part as a non-doctor. I'm amongst very eminent, very educated people. I'm aware of this, and thank you for letting me speak. I appreciate it. But my take on it is very simple. Is we need to have a system that allows anybody with no education to grasp what good health is from a very basic but not a patronizing step.
Very well. Thank you very much, Andrew. Who would like to pick on that? How can we, what is the information that we need to, how can we raise this awareness of what is being in good health and how?
So this is why I talked about modules and things online with training. So kind of not seeing somebody in a week is not good for your health. Now with COVID that's happening in Scotland, but actually not talking to another person on the phone is not good for your health. Not brushing your teeth daily is not good for your health. Not bathing daily is not good for your health. Eating too much, we know that's bad for your health, but that tends to come out because you're not washing and doing all this stuff. Going outside and looking at the sky every day is good for your health. So we presume, one of the things I get very frustrated with working with people who have got better education and have a better set, is we make an assumption that other people know what they're doing. We have to make an assumption people may not know. So people might not know that I need to bathe daily, or that actually going out and looking at the sky daily is good for you. And that information we given a module that's tiered up. So we do one in Britain on Scotland called Couch to 5K. My wife's just done that and found it very useful. So it's walking first and then running. I'm a wheelchair user now. So I can't do that, unfortunately. But I know getting good anaerobic exercise for me is important. But that's through my training, not through life experience. So I think we need to bring life knowledge, you guys need to bring knowledge down to individuals that is good for health, but actually in a way that doesn't presume that people have a basic understanding. So the question is, if you were neglected and didn't have any upbringing, what would you need to know? That's the standard starting point for this. Thank you.
Can I just pick up on a point that Andrew made there about being, I guess, honoured to be part of health, these health professionals. But that's why I think it's really important, this idea that healthcare services are actually repair shops, which means that the experts are very good at repairing things. And I think, as I'm not sure how to pronounce your name, Vitanis, that I quoted the same thing last week about 10% of the healthcare system actually influences health, which means the 90% we're not experts in. So in other words, what we need is health departments. We don't want more repair shops. We want more health systems. We want not medical schools. We want health schools, because they currently don't exist. And I think that's the issue we've got. There's the need for far more information about how you manage that 90% and improve on that, and then we'd improve on health. So I, for one, am not an expert, but having been in the health system for most of my life, realised at the end of it that I don't really know that much about health at all, and that a lot of it's determined by economics. I don't know much about economics, and a lot of it's determined by, as you say, it's social factors. And education probably being top of the list as being one that has an influence on health and life. So just that's what we need to address somehow.
May I quickly come in on that, Brett? I love that. And at the same time, I see that a lot of knowledge that you are missing is around, but it's what I call in the private medical realm, let's call it, because in many countries you have this division between private health insurance and public health insurances, and the public health insurances just don't pay anything that covers this, and they don't pay the teaching around it. And what I would love to do, if you permit, Brett, I have drafted this document. I would love to send it to you, where I make the difference between public and private realm and all the knowledge that is in the public realm. And there are actually teachers who travel around the world and are teaching that, and they actually attract thousands of people, but they pay that out of their own pocket. So this knowledge is spreading, but completely unattached to any politicians, any governments. It's in the private area. And that's why I'm saying the political will is missing, and consistently. But if you permit, I would love to send you the document.
That'd be great, thank you.
Excellent.
Let me just come in on this one, because I think here is something that is emerging now, an idea that is emerging in many different fields, is a need for big data repository, and this ongoing discussion, what should be public and what should be private and what should be corporate, and so on and so on. And maybe thinking about health union, we can think in decoupling different layers from infrastructure, data, applications, services, and then even networks, and maybe use the same model as we use in transport, as it's used in the energy field, as I can see now is emerging in some other fields as well. And health maybe can do that as well within us. We might have a discussion on that and really push that all the experiences, especially if they're funded by public money, they should be part of a big public repository that everybody can learn from, and each doctor can search for clues. And this could be seriously step forward and could bring a very powerful tool on board for preventive care, because we would be able to do a much more thorough analysis of causes, and then really bring attention to the environment that creates conditions for sickness, illnesses, and then address that environment better in order to prevent. As you said, within is 50, or you said 50% are behavior-based, if I'm not mistaken. I mean, that's amazing, you know? I mean, we should be able to address that better. And these percentages are very well reflecting all our discussions last week and this week. And that could be a good model to start the declaration on. You know, 50% of our resources and time should be focused on behavior, 20% on environment, 20% on genetic, and only 10% on health. Maybe that's a good provocative starting point, because it's backed by statistics.
Yes, Violeta, you're absolutely right. Because if you can just look at situation with children obesity, it's really, it is very difficult picture in the EU. You can see that children obesity is going up in very fast way. But why? Because please look at behavior environment in which now our children are. They are sitting around iPads, iPhones, and they can see a lot of choices related to sweeteners, fast food, and so on. Advertising around is so aggressive. A commercial determinants are so aggressive to make profit, because of they need only profit. They are not ready to understand what is with our society. If we have 25 or 30% of children with overweight and 15% with obese children, it means that you need in the future much more public money, dealing with non-communicable diseases. Is vicious circle is around us. Behavioral issues are in our culture, between our oldest population, and children are learning a lot from environment, and they are keeping it, and immediately they are repeating the same behavioral approaches, and then it is so difficult to change. Lifestyle medicine It's very difficult area of medicine, which can change a little bit situation with behavioral risks, behavioral challenges. Of course, we need to have in our hands a lot of instruments, but now today science is full. Yeah, we see shelves of books, shelves of proposals, shelves of public health instruments. How can we introduce taxation issues? What can we do with marketing? How can we provide a regulation to diminish commercial pressure on our children and adolescents? What can we do with healthy food? How can we change today's global health chain, which can, full of preservatives, and how can we produce more fresh food? It's a lot of issues related to our behavior, environmental, and our everyday business. Please look, we have in our hands proposal to have a healthy kindergarten, a healthy school, a healthy city, healthy communities, but we need to have political actors and political leaders and a lot of grassroots movements can really, keep it high on the agenda, as just presented in slide of Occupy Wall Street. You can see pictures which are against fast food, against such huge piece of commercial determinants around us. And we need to be vocal, and we need to raise those questions, because holistic approach is simple word, but it is very difficult to implement in our nowadays political reality. We need to understand fragmentation and commercial influence, lobbyism. You see around us a lot of forces who are against us. Can you imagine how it was big debates about situation to put calories and ingredients on our labels related to alcohol, beer, wines, and till now we solve it in very difficult environment. Why? Because of commercial interests. And we need to now to understand that the strategy from farm to fork should be based on concept of health and healthiness. How can we use instruments of healthiness in every area of our life? Otherwise, we can lose a lot of opportunities in the future. We can act now. I fully agree with political will, but such political will be collected from grassroots, from European citizens, from our common efforts to press on our parliaments, on our governments. How can you explain a simple example? Just European Commission proposed to have Health for Europe budget. It proposed 9.3 billion euros. And Council of Heads of States and Governments decided to reduce such budget 75%. Because they need to have enhanced direct payment to our farmers. Okay, guys, it's not comparable. Our farmers also are sick. We need to have, possibilities to leave something behind. But we need to have public financial system more resilient and more targeted. But if you see political leaders who are so blind, what can we do?
A strong question.
I think only one way. We need now just draw attention on awareness and messages.
Vidinis, as you know, I think we just have to keep going, like the Energizing Bunny. I mean, we need to keep going, and we need to keep speaking up, because this is a process. And I feel that we are at the beginning of a very big river, but we are still in the stream right now. And this will start piling up, but we need to speak out. I mean, conversations like this need to be everywhere. We need to have like a couple of hundreds of people who join and discuss, but it's a great beginning. And tomorrow we have a chance to say that. And hopefully we'll have a bit of influence to put certain hooks in the document that can give a support for broader discussion on these topics and bring the awareness. I think what you said is very tangible and it's day-to-day business. But as you know, in some other areas, we can learn from those areas. When we started to put negative externalities into euros and put the euro sign next to them, people started to listen. When we know that the rehabilitation costs for road safety accidents, only rehabilitation cost 250 billion euros per year, people started to listen. We can use those 250 billion euros for something else. So, and this is what, you know, I feel that is emerging. And I fully agree with you that grassroots movements, loud professional voices, can only give a support to those in political levels to be even more confident and to be louder and to be more present in a day-to-day activities. So let's acknowledge that we're at the beginning of process, understand that there will be challenges everywhere, but it's great to co-create something fresh and new, and it seems like the natural cycles are on our side. I mean, you know that I set myself a goal for 30 years for Ecocivilisation to become a mainstream. So, and I think I'm constantly surprised how much has been achieved in 4 months. So there is hope, yeah, that this could get stronger and stronger.
But if you allow me, Violeta and Vytenis, in order to help the grassroots movements, in order to help everybody understand a much wider platform, and use the example of from mobility that you just cited, Violeta, I feel like we have very skewed information. We really don't have enough information available to develop a debate at a wider scale. Could we start with this? Could we start by promoting arguments, statistics, evidence about health-related or community-related health issues, behavioral-related health issues? Because I feel that we are worse off than with, you know, in some circumstances with climate change or, you know, traffic safety in some ways. Many people don't know. And I told to Violeta yesterday, my mother doesn't know that it's much better, you know, to keep herself in good health than going on medical checks all the time.
So one of the things I found interesting would have been at university. So I was only at university 2 years ago. I was a very, very mature student. It meant I was with children, or people, sorry, children between the ages of 18 to 22. And one of the commonalities is loneliness. They were all lonely. They could talk on chatbook, but really struggled. So they set up a garden centre, a garden unit, and they were oversubscribed. They had to bring another one in. And what they found is students were going there and meeting and working together. One of my original training was a horticultural therapist with people with mental health issues. And I worked in a homeless unit. And what we found was we had better engagement with clients when we done gardening, and we worked with soil, and we worked with them than otherwise. So there is already statistics out there that you could gain. So it's not like you're asking for things that aren't there. They are there. It's just asking them the right way. I wonder if you need to do a quick survey throughout our nations and asking what communities do we have working. Yeah.
I would like to invite other participants to perhaps add their comments and suggestions.
We have with us also Christian, who is an expert in circular economy and a very good speaker as well. Christian, what did you take out of all our discussions with you today? What do you hear? Please come on.
Yeah, a lot of challenges. It's very interesting discussion also last week. Sorry, my camera, I see it's not operating. Thank you for your letter. Yeah, I see a lot of connections also to the transition we are making in the circular economy, as you might recognize. It's also about collaborating. It's a very big vision and big ambition, but make it also small and very people-oriented. I also last week how to involve communities. I think that's very strong also in the health to look at that. Recently, I'm also looking, and don't feel it as a marketing talk, the patient as a customer. So if you look at from that perspective, what would that change? And especially I'm interested also in the so let's say hospital journey and that, and especially the after journey. I think that is very much out of scope of hospitals and a lot of doctors, and that's also where you can help a lot of patients. How to recover after cancer, and let's say the official scientific and underpinned elements are done, but yeah, people are not back on their head, let's say their mindset, so their body mind, it's not in balance yet. I see it also from let's say my close environment, how that works, and how much we can improve there. But yeah, it's not budgeted like that, it's not arranged like that, it's not insured like that, we're not educated like that, also holistically. So in that sense, yeah, sorry for all the open doors, but that's what I see.
Great.
Thank you. Very good summary, Margaret.
Yeah, I mean, I've been very thoughtful this afternoon. These are big questions. We've been, many of us, thrashing them around for decades. There are no quick fixes, but I do think there is something important that is emerging around the framing of the questions, that they are relational, they are holistic, they are that person-centered. What matters to me? What matters to you? And what's happened to you is the other question that is also important to ask, because of the antecedents from childhood that impact on people's lives so heavily in terms of their health trajectories, their health pathways, and also their actual attitude towards engaging with their health providers. So there's many aspects that there to be thoughtful around. But my message, really, I was trying to say from last week and want to repeat, is that the future is already here. It's just not very widespread. There is a new model trying to be practiced, both in, at a very small scale. I mean, in Fife in Scotland, where I've worked, it is still very small scale, but nonetheless profound in terms of the impact it's having in people's lives. They're seeing that they are agents in their own lives. They are able to forge a better future for themselves, or at least be trying to, even if in the face of the illnesses that they're up against, they're not going to survive, but nonetheless, they're having a good death. And I think that too is also an important part of this. But there are other examples with, the Nuka model I mentioned in Alaska, which is a much better scale than what we've done. And there are some practitioners, particularly I find in the primary care realm, the GPs, we call them GPs in our country, who have got out of their surgeries because they've got fed up with that prescription pad approach to medicine. And they recognize that the whole community needs to be connected and mobilized to support the management and indeed recovery from chronic conditions, non-communicable diseases. And it's been a really profound shift going on. I think what, in terms of data we can be collecting, is these examples. These examples of I'm talking about radical reductions in use of healthcare provision, use of hospital healthcare, because people feel they've got people in their lives, in the way that Andrew's describing, who they can sit down and have a cup of tea with and just offload, who they don't. Loneliness is a bigger problem than smoking in terms of our impacts on health. We need to get away from this sort of all about the lifestyle and much more into the relationships. That's the key, I think, for me. And then that relationship isn't just human relationships, it's our relationship to our other species our planet, our cosmology, if you want to go there. You know, it's at all levels. So yeah, I just wanted to say that I think that there's very rich data sources now emerging around that third horizon, and that's what keeps me going. It's what gives me hope that we can get to a better system in the future.
Excellent.
Ahoy.
Really very very good to stay on the optimistic side, and thank you for exposing some of the best practices that we touched upon last time, because they can lead the way, and they can reassure us that actually things are moving on. I would like to ask once more other participants if they would like to add their own views and reinforce this message maybe by their own experience and engagement before starting to wrap up with our speakers.
Matjaž, would you like to say something? I know that you've been following this. How do you feel?
Hello, this is Matjaž speaking. Thank you very much for inviting me. I was wondering about two things, and one thing is that we should encourage and promote values that are important for all of us, and we should do this through the educational process, because kids in school, they learn a lot about other stuff, but they don't know much about healthy lifestyle, for example. So we should really promote this. And what came also to my mind is that, let's say, sport activities, nutrition, going outside, spending more time outside, this is very important. And we can do this by encouraging our kids and also through our school system.
Thanks. And I think we have a younger representative among ourselves, if I'm not mistaken. Uroš, you are still a student. What do you get out of all this? Too shy.
Okay. Hello, is that me?
Yeah, Katerina, hello.
Yes, hello. It's not about shyness, Miss Bulka. Thank you for having me as well here with you all. Every time I join the sessions, there's always something new and inspiring that, as you said earlier, it just keeps us going because we have to do something, regardless what's the general, how can I say, the general conditions. Either this is called COVID, or this is called Balkans, or if this is called Greece, and an upcoming lockdown, and how this will stop again everything that we consider that needs to be sustainable. And all these things that have changed our everyday life here as Sustainable Food Movement, I'm talking now. Yes, we are doing our best. I'm not as an expert. Apologies for not having the guts to always raise my hand and ask something. But because we are a very small organization in Greece, and we're doing our best to tackle food waste, and not only, to promote sustainability in all sorts of aspects of either working life or everyday life or school life. And to me, because I come from an HR background, I'm trying to see now all the aspects of essential corporate social responsibility, because I don't want to take it too far. When I was doing my degree, the term CSR was relevant to marketing. It was another word to call marketing. And at the moment, even the word sustainability seems somehow not as an oxygen. You know, in Budapest in January, we had gone with my partner, with my work partner in a meeting about sustainability, and what there, I was told that sustainability somehow is not even on the surface of the table. We are beyond sustainability. We need to rejuvenate the whole world, our thinking, the environment, and all this keeps us thinking how we can collaborate what we know, what we learn, what we are taking for granted with the everyday life. And as it's something that we are running at the moment, because you mentioned about circular economy, I didn't follow you from the very beginning, so I apologize if you have mentioned it. We are doing a few actions now, and we're taking some initiatives for the week 12th, 18th of October, with the circular hotspot in Poland and in Ovo. And what we are trying now to do with the Greek municipalities and the Greek schools, high schools and lyceums is to, it's not about educating them. I think this is a term that doesn't belong now, educating. We shouldn't educate the high school. The high school should be already on its way to participate in anything that has to do with eco-civilization, sustainability, circular economy. And I'm talking with a bit of, I'm not very happy at the moment, because sometimes we have been trying to communicate the basics to us, and we are finding walls that somehow do not make all this possible. And it's nothing. It's not about money. It's not about physical contact. You know what I mean now with the COVID area. It's not something huge that needs to be organized and they don't have the resources. However, they're trying, we are finding a wall which somehow needs to be broken. And the only thing we can do is just to keep going and do our best. This is what I have to say. I know I was not very technical in the conversation, but from my point of view as a sustainable food movement in Greece, and while we are preparing now this project for the 12th of October, for this week, I wanted just to make a statement on how different countries deal with the same issue, which should not be like that. It's one thing, it's we are one, we are all one in this project. It's not even a project, it's our life, it's our future, it's our kids, regardless if someone has a family. It's so beyond that. That's all I wanted to say, and that's all. And thank you again for having me here.
Thank you, Katerina, for being so persistently with us through this journey and for this intervention. I would like to emphasize, yes, the high school goers should become participants of change, and it's a very good point. It's maybe a little bit late to start educating there. It's much more important to engaging. And we have that Swedish high school goer and some other youngsters who are giving a great example for that. Anybody else before we wrap up?
Very quickly, we need to make sure we don't miss people who are self-excluded from society. So I work with a lot of adults who didn't go to school, yes, or attended, so doing it through the high school system may not work. So we need to do it through generations and through community, where children get picked up as children and not as part of the education system. So it happens in the household, not at school, would be my preference.
And let's not forget the elderly, of course, in this process, who need in many ways to be empowered.
Yuri, before you wrap up, I do need to bring to the attention, and I hope with Ines we can explore that further later, something that we also discussed and you put in the notes, but you have not mentioned today. The thing is, what do you think about starting like something like Paris Climate Agreement for health? So to have, I don't know, Ljubljana Health Agreement on a level of not only EU, but UN as a special envoy. Maybe you can bring this attention to the Secretary General and we can start maybe with Europe and then invite others. Or maybe we can start globally immediately and not be too uptight with the size, but more with the quality, that we get something done at the beginning that could then steer and provoke a much broader discussion on a global level. That is something that might be feasible. What do you think?
Absolutely. Absolutely, Violetta, as you know, from my point of view, Paris Climate Agreement is the second biggest international agreement related to health. So the first one was a framework convention on tobacco control. Now we have it in our hands globally. As you know, now we are in a way to ratify illicit trade tobacco protocol, which should be legally binding around the globe. And we have it now again, we have a little bit, to be optimistic because it works. And second is Paris Agreement on climate change. Because air pollution and all issues related to carbon emission and global warming, they are so interconnected with soil health, plant health, animal health, and people health. It's very interconnected. When we are speaking about soil health, about plant health, about animal health, please keep in mind, we need to understand, how big today pollution influence on all species around the globe.
Yeah.
And of course, it includes people. As you can imagine that because 400,000 people premature death because of air pollution in European Union, yes. Only this year. And nobody
only in Europe, only in Europe.
Only in European Union, only. And nobody is and no headlines, nothing, no, attention, nothing. It's like something, simple. But look, but if you keep in mind droughts or heat waves or storm, you can calculate much more. It means that when we are thinking about global Paris Agreement, we need to keep in mind health of all levels, soil, species, plant health, animal health, and it is because of ours. Of course, we need to discuss how can we agree on the more or less global, roadmap. How can we monitor the implementation of Paris Agreement because of health of different components of our life? Because we are all interconnected. Please look at our Earth as a one big, space, entity. But it is not a joke. It's reality. Now we are absolutely interconnected, and of course it will be good to push much more the keeping that it is about healthiness. It's about people, quality of life, about quality of our water, quality of our soil, quality of our food, about all components. That it's not so without evidence. It's based on evidence.
I agree.
Thank you.
I think Daria,
Daria is with us with the picture.
Wants to say something. Daria, go ahead.
Yes. Hi, everyone. Thank you for having me here. Being a biologist by education and by heart, I'm really delighted to see that those initiatives are happening and strongly support the idea for Slovenia to be one of the leaders and the, let's say, pilot market for such initiatives regarding the health. Since I do come from the previous years from the pharmaceutical industry, and I do notice still that there is a huge lack of responsibility, personal responsibility of people that are struggling to be healthier, to have the right for life. A lot of demands But coming from their shoes, when there is a need for a behavioral change, there is a huge gap here. And having education at the heart of these initiatives, so as you've put it, place it in educational system, starting from the kindergarten, we can see what happened in a decade with the recycling initiatives. We couldn't, when I was a kid, we didn't recycle anything. Nowadays, we all do, right? So starting from the kindergarten on, so when they are in secondary school, they can engage heavily in those initiatives. So one point is absolutely education. The other thing that I would like to tackle here is that we are disconnected from the nature. And I see here huge
challenge, right? Huge task to be accomplished. Yeah.
Yeah, sure. So if we would be more connected, we could really understand easily what environmental issues are. How can we reconnect back to our health? Where are all the possible advantages and possibilities to find health, let's say, approaches, not just from the pharmaceutical. 10%, I completely agree. We can and must approach holistically in this matter. So strongly supporting the idea. But at the heart of everything, education, all level, and preventional programs.
Thank you.
Thank you.
Very well. Violeta, what do you say? Shall we start gathering our last ideas? Maybe with Brad, Margaret, and Barbara, or is there anybody else who would like to add something on? If not, then I'm passing it on you, Brad. If you would like to share your last reflections for today, please.
You need to make sure you're off mute, Brett.
Yeah, Brett. Brett, we cannot hear you at the moment, but we see the slides well.
There, sorry about that. Yeah, just to, obviously we've covered a lot of ground, but I think education came up a few times. So I just thought I'd take this opportunity and showing this slide to indicate where you get your biggest bang for your buck, according to the Nobel laureate James Heckman, indicating there you get most of your bang for your buck before the, well, during the first, preferably before first 6 years of life, and after that we're starting to get into repair, and the older you get, the more cost it is in terms of the repair. And it's not changing. Oh, there we go. This is thanks to a school friend of mine who's based in England, and just sharing this slide. And of course, politicians will say, well, we can't wait 100 years for to see the benefit of this suggestion. But what I would say to that person is you do get more immediate benefit. And this is from the Robert Wood Johnson Foundation, showing that an extra 4 years of education will reduce diabetes, heart disease, overweight and smoking. And I'd like to hear from someone who can suggest that the repair shop approach to these things can be as effective as education at changing things around. And if I can get back to a previous slide, just some of the positive things that are happening. The fact that there's this co-benefit, if you can, what we've talked about, the natural environment and how we need to be more integrated with that. And so there's co-benefits from that. In Australia, they've produced this documentary and a book to go with it, with a whole lot of very practical suggestions as to what we can do about it. And as I say, a lot of co-benefits, which this iconic cartoon, I'm not sure if you're all familiar with it, showing that, you know, even though people are saying climate change, as our previous Prime Minister said, climate change is crap. Even if you do try and do something about it, there's a whole lot of spin-offs from that. So I guess in conclusion, it's been wonderful to be part of this process and to think about ways we can go forward, especially that idea of the avatar that was mentioned there, and blending everyone's ideas and coming out with some sort of declaration to say this is what we need to do as a collective. So they're my views.
Thank you, Brett. May I pass on to Margaret and Barbara then?
You're waiting for me, okay. Yes, thank you. It's been a great honor and privilege to be involved in this conversation, and I suspect it's only the beginning rather than we're coming to the end of this session, but it's a very rich discussion, and I'm very open to further dialogue on this. I think what's striking from what Brett was just presenting there was the value of a longer term view, and Violetta talking about a 30-year transition. 2040 is the book that came up, and 100 years for the children to live into the next century thriving. And if we can start to imagine their lives and their children's lives, I think we're starting to think a little bit more radically about what kind of things, what sort of lives we're going to need to live in order for that to be a reality. I'm excited about that prospect because I think it's a better world that we can create. It's not a compromise. It's not a sort of regression. It's actually it's a better place for humanity to arrive at. That's what I aspire to for my children and their children.
Thank you. Barbara, may I challenge you?
Can't hear you.
We see the slides though.
You're on mute, Barbara. You're on mute.
Okay, thank you. I'm really thankful to this open space of inquiry that allows us to ask difficult questions and big questions. I think this is the most important time for this slow thinking and long-term thinking and re-questioning the self-evident and business as usual. And so we can ask ourselves, where is our attention, what we grow with our attention, where we place our intention. And what I would love to see with Dr. Andriukaitis also being here is to question again whether we can stir our common efforts towards health and well-being as the parameters of progress. Maybe we dare to go beyond GDP and economic growth that served us perhaps well, but might not anymore, and go towards well-being and health as the fundamentals for everything we do in all the structures of society, where we can really create health enabling environments. Because I always get a little bit, it's always a little bit difficult for me to hear about lifestyles and choices and behaviors. So how healthy can one really be when there is no chance of education, where somebody lives in a toxic environment and the only food he can afford to is fast food? So it's a very difficult issue to speak about choices in this regard. So it would be really hopeful to see that we dare, with all the knowledge that we have to support it, stir our efforts, our grand efforts towards health and well-being as deep parameters of progress.
Thank you, Barbara, for this note on parameters of progress.
If I may.
Please,
I fully
the
agree
word is yours.
with you. We need to change old formula of GDP.
Yeah.
Because such old formula of GDP was presented in 70s. Now the world absolutely different. And that's GDP is only measurement of GDP. It's not include quality of life standards. We see lack of indicators which should be included into calculation. Why we have such big gaps in our societies? Please look at very well developed countries. But you can see Gini index, it shows that a gap between poorest and richest are so big. And sometimes you see growing of GDP and poverty is in the same way. Or average of our wages is stagnating from the 2008. Only if you look at social determinants in health, you can see 35% of our population in the European Union, they have no chance to have more healthy conditions. They're using, can you imagine that today we have about 150 million in the European Union people under threat to be in poverty. About 50 million people can't afford healthy food every second day. And it is our European Union. But we are measuring only GDP composition. Sorry, we need to change situation. We need to include social parameters, social indicators in, doesn't matter how you call it, well-being indicators, it doesn't matter. But we need to include it into our, of course, also a question about GDP and sustainability, about profit and sustainability. If we are speaking about sustainable development, about circular economy, about sustainable evolution, we need to really to have data to calculate our progress, to measure indicators, and to really see in which areas we can now act much more faster. Please understand how many abandoned regions do we have today in European Union, where you have no access to primary health care because of lack of medical doctors, lack of nurses, and people are staying out of conditions. And it is our union. It's not only, we are not speaking about, about less developed countries. Let's speak about reality in everywhere. Of course, we need to have equality around the globe. And of course, it is up to us now today to understand global food chain. How many issues are included in global food chain? How many business people are exploring, cheap labor force in Africa, presenting to us food on our tables? Sorry, guys, but it is not worse. We need to keep in mind also equality issues around the globe, including in our trade agreement, also environmental compositions in our trade agreement. I fully agree with you that we need to act, we need to change our, formulas, our monitoring capacities to monitor situation in more proper way and more way which should inculcate people living and working standards on the ground.
Very well. So in a way,
please, can you help me? I think I'm still sharing the screen, and I don't want to.
You are okay. I will.
Please
let
help.
Me. I hope this is it. Okay, and thank you very much, Vytenis, for this intervention. May I just respond with this thought that perhaps the European Health Union can really start by setting up a convention and about the new parameters of progress. This could be a great outcome of this difficult period of the pandemic which we're all in. I cannot imagine, even with the circular economy, we are facing it's a much more focused, of course, topic than health. We have to admit it. But even there, we are facing practical problems. Like, if we want to introduce a new statistics in the Eurostat, we know that we need a cycle of 10 to 11 years before it comes into practice. But a convention like that would definitely be a game changer. I am passing on to Violeta to check whether we have said enough or we can go on.
Well, I'm afraid we have passed the time way back, but as I promised in all of my social media posts, we're going to go deeper, we're going to go even broader, and we're going to extend our foundation for the future conversations. And I think we did just exactly that. Every contribution was a little piece into this bigger landscape that we now have. And I do hope that tomorrow Vytenis and I will be able to bring some of the spirit and energy to the EU discussion as well. I would like to share a little bit with you the final thoughts, because I'm just even more energized by all your comments that there is a room for a new destination that we can share. And sometimes you could just not fix the old system, as Margaret showed in her graphs, but we need to dare to start to create something fresh and new. And little by little, when it proves to be valuable, it will suck in more and more of activities and society, if you want. But if we are wrong, then it's better we don't interfere. So I think the approach is right. And I'd like to continue to invite you to not only participate in this discussion, but to join us on other discussions as well, and get maybe even new inspirations that you can bring into your own field. Today we were able to see how closely the concept of being is related to all other elements. And when we look further into being, you see that we have humans, animals, plants, bacteria, viruses. We all coexist in one big planetary family. And we don't really know each other that well yet, because we were building walls instead of learning from each other and co-create a space where we can coexist. So I'm traveling hopeful in the future. And today we got Vytenis a lot of push to actually do something on political agenda as well. And let's see how far we can get. But we certainly will put some of these thoughts forward. And because we are two, maybe we can get the third one and the fourth one. And with all you behind, I'm sure that in a short period of time, there will be some new tangible results. So let's keep connecting and let's keep discussing. And if you have any kind of similar discussions, just connect the content, maybe even people, and let's start creating this new brave world that we dream about. I mean, we got to do it. Somebody has to do it. Why not us? That's my approach. Thanks a lot. Again,
thank you, Violeta.
My life has been really enriched by what I've heard. Yuri, back to you.
All that is left to say is a big thank you. I think this have been two very compelling and revelatory sessions. We have all been learning a lot from each other, and particularly from the three speakers, Margaret, Barbara, and Brett. We are very flattered that we are having you with us, Vytenis, this afternoon. It really means a lot. And of course, thank you, Violeta, for your enormous amounts of energy that keep us together and keep us inspiring to pursue the desired destination, the eco-civilization. As you know, we will continue sharing with you all the takeaways also from this second session. We will go on through the autumn to discuss the relation between the eco-civilization and communities, and the last session between the eco-civilization and the individuum. And then we are planning the first year wrap-up meeting in early December, and that is not all. So please stay with us. You're all welcome to contribute. As you see, this is a fully horizontal relationship here, and also I would like to remind to say it in front of everybody, please, Elke, if you allow, I would be really happy if we could publish your paper on our website, and that would be very much appreciated. So if it doesn't stay only with Brett, who was the privileged person already named, I will share it with, among all of us.
And it's really worth reading. It's a very inspiring document.
Right. Right.
Thank you.
Thank you all, and I'm looking forward to our next encounter. Have a nice evening. Bye-bye.
Thank you very much, everyone.
Goodbye.
Bye.